From here.
All right. Hi, Dr. K. Could you start us off with an introduction into with who you are and what you do?
Sure. Thank you, Josh. My name is Dr. Knox Kazmierchuk. I go by Dr. K, just a lot easier to say than trying to get both the last names together, which also both end in K. I'm an assistant professor in the rehabilitation, exercise, and nutrition science department. And I teach in two different programs within that department. So I teach in the athletic training program and I teach in the nutrition science and dietetics program. I've been with UC 2 years. This is going into my third year now. And prior to that, I was at another academic institution.
Why did you decide to go into your field?
So I was always really interested in science, really enjoyed science. When I was in high school, I took all the AP biology, AP anatomy course. And so I initially started off as a pre-med bio major my freshman year, and then kind of decided that I don't think that was what I wanted to do. Wasn't really sure. I had just a really rough semester my freshman year where I was in a cell biology course and then I was in an anatomy and physiology course. And so I don't recommend doing those two different things at the same time as a freshman coming into college and not really having good study skills. I was able to go through high school. I think a lot of high school students are like this. They go through and they, especially if they're really good at a subject, they can just go through and not spend a ton of time with it. And so I got to college thinking, oh, I don't really need to spend a whole lot of time with this. I can just kind of go in, read my stuff, and I'm good. And it was not that way. And so I kind of started thinking about whether or not I wanted to actually go into medicine or not. I started thinking about the challenges of it. And so I kind of psyched myself out. And in the process, I started seeing a career counselor at the university and um, ended up learning about exercise science and about athletic training. And I was also an athlete all through high school, an athlete in college for my first couple years. And I was just like, this is what I really want to do. I want to be able to work with athletes. I can still do all the sciences, which I love and enjoy, and I can really learn about the body and help athletes stay healthy and recover from injury. So that's how I got into that, into athletic training. The dietetics degree came much further down the road, and if you want me to kind of get into how I got into that, I can talk about that a little bit as well.
Could you actually talk a little bit about that and what drew you to dietetics as well? I mean, yeah, in addition to athletic training.
Sure, sure. So with dietetics, I was always interested in nutrition, and part of it was being an athlete all my life and really trying to monitor what my intake was to be able to be healthy, to be able to be good at my sport. Um, I started really getting really interested in it because part of the athletic training, one of the domains of athletic training is in nutrition, and so I had to take a nutrition course in undergrad. And I was like, oh, okay, I think I like this. But because I went to a small liberal arts college, they didn't have a major in nutrition or dietetics. And so I ended up going on to graduate school for exercise physiology, graduated, started working as an athletic trainer, and realized that a lot of my athletes had nutritional concerns and they would always have lots of questions. And I felt like I couldn't really adequately answer some of the questions that I was being faced with. And so I thought that a nutrition degree, particularly getting a dietetics degree, would really complement what I was already doing and basically be able to better serve my athletes. I took a couple other turns along the way in terms of um, what I actually wanted to specialize in nutrition. I went in thinking I was going to do sports nutrition and come back out and work in an athletic department with my athletic training degree and with my nutrition degree. But along the way, I started doing community nutrition work for my graduate assistantship and just really loved doing community work and um, doing management of chronic disease. And so ended up doing community-based nutrition.
Could you talk about what a typical day like is for you?
A typical day in terms of um, being a professor now, or a typical day when I was working clinically?
Both.
Okay. So a typical day when I was working as an athletic trainer, because before I went back and actually did the nutrition degree, I worked as an athletic trainer for several years. And I worked at a university. And so a typical day for me, if I wasn't traveling, basically meant me waking up, I would go work out, shower at the gym, and then um, go start my day at somewhere about 9 o'clock or 9:30 with doing rehab with some of the athletes, depending on what their class schedule was. After they would rehab from anywhere from 9 or 9:30 up until about 11 o'clock, 11:30. Then I would have lunch at my desk as I entered in athlete information into their charts and documented on their rehab, and then wrote up some new rehab exercises and progressions for the next session. And then um, after my lunch, my working lunch, then I would start getting ready for practices. And so a lot of times for practices, they would typically be somewhere around 3 o'clock. And so for each practice, I would have to get ice and water set up. I'd have to get my injury supplies all set to make sure that my athletic training kit was fully stocked. And then I basically wait for the student athletes to start rolling in to do rehab and to do um, taping or any other thing that they might need from for before practice. And so somewhere between 1 o'clock up until 3 o'clock when I was leaving to go either to the gym or field, it would be this kind of mayhem in the training room. But it was like a good mayhem, lots of energy, lots of movement, um, guys and girls in and out of the training room needing different things before they got ready. And then after that, it would kind of calm down. I'd go sit on the field or sit in the gym, watch the athletes practice, and for the most part, it'd be pretty easy and calm. 2 hours, 2.5 hours of me sitting on the sidelines or sitting in my little training cart if I was outside. If there was an injury, then I would kind of spring into action, do what I needed to do to take care of the athlete, get them off the field, and get them back down to the training room. But most of the time, it was pretty calm. And then after athletic training practice, after practice, I head back to the training room, break down all my supplies, and then um, go through the process of post practice where people would ice, do some more rehab, and then off they would go. Then I would get everything cleaned up, and I think my day would probably end somewhere around um, probably about 6:30, 7 with me leaving the training room. So it was kind of a full day from starting at 9 o'clock and then getting out of there somewhere around 7 o'clock. But I definitely loved and enjoyed that aspect, the energy that was there with athletic training. Um, and then for dietetics, it was kind of the opposite of that. It was pretty calm and even throughout the day, depending on where I worked at. So for the most part, I worked doing community and clinical dietetics, and so I was working within a hospital system, and so I would basically get to work at 8 o'clock or 8:30, and then I'd be done somewhere about 5 o'clock or 5:30. I would typically see um, anywhere from 8 to 10 patients a day, depending on if it were um, an initial assessment that I was doing, and then I would teach a couple group classes in the run of a day. And so that was a pretty typical day for me as a dietitian. As a professor, it's anything goes, that my days are never the same where I could be writing a grant one day and frantically trying to revise my bio sketch, or I could be teaching a class or doing an IRB or writing a manuscript, any number of different things, or working in the community.
And when you were working as AT, how were you able to manage your time with everything that you had to do, working such long hours?
So I think for that particular thing, it was helpful initially because I was single, fresh out of graduate school, and so I was like had lots of energy, and I was like, yes, this is great. I get to be with athletes again, and it was just kind of go, go, go. And I loved living in the gym, and so I would basically just be at the gym all the time and be around sports all the time, which I loved and which was a passion. And so I think that for me, I mean, part of my personality is that I am a workaholic and I like to stay busy and work, and so I enjoyed being busy and working, even when I would have travel where I'd be gone for 3 or 4 days. And when you travel, you're basically on and you're working that whole time. Um, and so um, as I started getting a little bit older and being in the field a little bit longer, my role and job started kind of shifting. By the time I was transitioning out of athletic training, I was only traveling with a couple teams, and I was actually working at the sports medicine clinic with my physician, well, my sports medicine doc, who was the team physician for the university, and so I was doing more in clinic work. I think the thing that you have to understand with athletic training is that when you get into it, particularly if you're getting in at the university level and you're traveling with the teams, it's a lot of travel. It's definitely a lot of work, and you have to have family members or partners that are going to understand that, okay, I'm going to be traveling. There's going to be a lot of work that's involved initially as I'm settling into as I'm settling into the career. It does get better, and I think that now it's a lot better than when I first started off in athletic training back in 2000. So I guess it's 20 years ago. So yeah, so it's much better now, where now you have specific FTEs required for a number of athletes that you have, where when I was doing it, you might have um, anywhere from 12 to 16 athletic teams and maybe only two athletic trainers for a whole university. Kind of crazy when you think about it now. I look at UC and the number of athletic trainers that they have on staff. I'm like, wow, my you guys have tons of trainers. Like, oh, my you guys are so lucky nowadays. I think that helps now with the management by there being a specific mandate for the number of FTEs per student athlete.
How has being a woman of a diverse background affected your experience as an athletic trainer?
You know, like at the time, like being young, I don't think that I thought about it that much. I knew that I had to work harder, and there are lots of different things that I had to do to try to fit in. So just trying to, I remember at one point in time I was taking golf lessons because it seemed like all the coaches and the guy athletic trainers played golf, and I was like, okay, I'm being left out all the time, and so I'm like, okay, I have to take golf. I have to start trying to go to these different golf events to interact and play with them. And so it's one thing that I knew I had to do, being a woman, being black. So I wasn't in the boys club at so to speak, and literally at that point in time. Um, I think that it's kind of nice being naive to some of these different things. I feel like when I was younger, I was much more naive. I definitely knew that there were differences due to me being a woman and due to my race, but I think that I was naive in the sense that I felt like, oh, okay, well, I need to just keep working harder, and that particular thing is going to make a difference after time and age. Like, yeah, like it helps, but there it still you still can be limited by having a diverse background, and so it's like you it's the unfairness of having to go through the process of working harder than someone else to be able to gain the same access. So that's kind of why I do some of the work that I do around cultural competency and equity, just based on that experience, and kind of looking back at the hoops that I had to jump through in a lot of instances for whether it was athletic training or dietetics.
What advice would you give to any pre-med or not pre-med, any pre-AT students or any students interested in AT from any backgrounds? If you could give them any piece of advice, what would it be?
I would say do your homework, do your research, figure out what the major actually entails. I think that a lot of students that I talk to, they think, oh, it's athletic training. I'm going to be around athletes, especially when you're at a large Division I school. There's something cool or sexy about being around Division I athletes, and so I see students just kind of want to jump into this, but it's hard work. So it's a science, and you have to put in the time, and you have to um, be able to really manage your personal life along with your schoolwork, and then you have to know what it's going to look like down the road in the future in terms of the amount of schooling. So AT is actually switching like a number of the other health disciplines have done, and they're transitioning to entry level at the master's level. And so that's extra schooling, which means extra money. And so it's something that students should think about, and they should ask all those questions along with things like expected salary, things like financial aid for doing this program, or their scholarships for doing this thing. So that way you get a good return on your investment if you're gonna do this particular major.
Dr. Selzer, do you have any questions?
I don't think we got to hear what sport you played.
Oh, so I ran track. So I played basketball and ran track in high school, and then in college, the first couple years I ran track. But with athletic training, you have to accumulate 1,200. What was it? 1,200? No, AT dietetics is 1,200. You have to accumulate back in the day 2,000 hours to be able to sit for your exam. And so part of accumulating those hours was working in the athletic training room and doing um, the pregame setup and management, doing the rehab, doing the post practice and post game breakdown to be able to know what you're going to be doing later on. And so you can't really do both. You can't really do athletic and athletic training, at least back then when I did it.
Hmm. And so for students who want to shadow, especially right now with some of the limitations with COVID, for dietetics or for athletic training, what would you tell them just to kind of close up?
So for students who are wanting to learn more about the field, I think that right now with COVID, it's pretty hard to get into a clinical site, especially for someone who's maybe a freshman or maybe someone who's in college who's exploratory studies or in health science, and they're trying to figure out, well, do I want to do AP, PT, dietetics? The best thing that you could probably do at this point in time is really trying to reach out to people who have worked in those areas and asking them kind of what Josh did. So, what's a typical day like for you? And really trying to get specific about, so what does that mean? What does that look like? Have you been, like, I only recently stopped working clinically as a dietitian, and from the time when I started up until now, it's changed pretty dramatically in terms of caseload and time that you can spend with patients. Documentation has changed, and so really trying to get a good understanding of, well, how's it changed, where are they going, and talking to at least three, maybe even four people to figure that out in different settings, so that way you know what the different settings are like, and then finding out what the job prospects are like in each one.
Great. Thank you. And thank you so much for your time today. We really appreciate it.
You're welcome. Hopefully it was helpful, and it'll be good information for